बिस्मिल्लाहिर्रहमानिर्रहीम। मेरा नाम डॉक्टर साजिद है। मैं कंसल्टेंट चाइल्ड स्पेशलिस्ट हूँ। टुडे वी विल डिस्कस ए केस which often come across in post graduation examination. Your command will be do the lower limb examination, or patient having weakness of the one lower limb after viral flu, or patient having IM injection 2 weeks ago now having difficulty in walking. फर्स्ट इंट्रोड्यूस योर सेल्फ एंड टेक इन्फॉर्म कंसेंट। जैसे मेरा नाम डॉक्टर साजिद है, मैं आपके बच्चे का मुआयना करूँगा जिससे इसकी बीमारी की तशख़ीस में मदद मिलेगी। मेक ए गुड एक्सपोजर मिड चेस्ट टू मिड थाई। इफ़ वेदर इज़ कोल्ड आउटसाइड, रब योर हैंड, देन मेक पोजिशन ऑफ द चाइल्ड। Head should be straight, arm should aside with legs straight, and body should be in one plane. Spend 20 seconds in observation after going towards foot end. Look for NG or Foley's has been placed to the patient or not. If NG placed, think of bulbar involvement. Take respiratory rate for 6 seconds. Move to side and now. Look for pink eyes, mouth ulcer. This is for Coxsackie virus. Now do motor examination, and first part of the motor examination is gait. Follow the same scheme. If the patient cannot move lower limb, think of GBS or transverse myelitis. One side paralyzed, think of stroke. And if one limb is affected, think of polio or traumatic neuritis. Now, if patient is dragging one leg and not able to walk without support, think of either polio and traumatic neuritis. In polio, patient would having dragging leg and walking with support, while in case of traumatic neuritis, high stepping of one foot can be observed. Pain and tenderness of affected leg can be appreciated, but it won't be in case of the traumatic neuritis. Bulk relatively reduced if 3 weeks has been passed in case of polio, while it would be normal in case of traumatic neuritis. Tone will be decreased in polio as well as in traumatic neuritis. Power will be decreased in polio as well as in traumatic neuritis. Reflexes will be decreased in polio. Knee reflex persist in traumatic neuritis, while ankle jerk would be the loss. Bladder examination would be normal in polio and traumatic neuritis. Cranial nerve would be normal, but if bulbar involvement is present, then 9th, 10th, 11th, 12th nerve would be affected in case of the polio. This can be checked by doing gag, talk to the patient for nasal twang, check tongue movements by protruding tongue. Sensation would be normal and intact in polio and traumatic neuritis. Now have a look over the back, which would be normal in case of polio, while a dimple over gluteus maximus can be observed in case of traumatic neuritis. Now check the pulse and blood pressure, cover the patient and say thanks to the patient. Now give concise and brief description, like a 5-year-old child lying down comfortably with no obvious respiratory distress, with respiratory rate of 20 per minute and pulse rate of 110 per minute. Patient having relatively reduced bulk of left leg with decreased tone, power 2 by 5, decreased reflexive with non-specific Babinski of that side. Patient having normal sensation of both legs. There is no bulbar involvement, no pink eye, no mouth ulcers. Bladder is not palpable, and no dimple over gluteus region has been observed. On the basis of my examination, my differential are most likely polio, traumatic neuritis, enterovirus infection like Coxsackie virus. Sir, I will do some specific as well as some sporting investigation. Just name the investigation, like two stool specimen, CSF analysis, serological tests, nerve conduction study, and PCR for other virus. Now, if the examiner asks about any investigation, must explain like, sir, I will do two stool specimen, minimum 8 to 10 gram, should be within 24 to 48 hours. CSF analysis, pleocyte can be appreciated in case of polio, while in traumatic neuritis it would be normal. Serological test, four-fold raised antibody titer, but it would be after 3 to 6 weeks. Nerve conduction studies show axonal damage in traumatic neuritis and PCR for other viruses.